Hey there, and welcome back to the Deep Dive.
Hello.
So today we're diving into a specific set of sources. It's all about a dentist, Dr. Hasan Gemici, and this health center he set up called Mediglobe.
That's right. And we've got quite a mix of stuff here. His background, what Mediglobe actually offers, some details on specific treatments they do.
Yeah, like implants and zirconium, apparently, plus patient feedback, clinic logistics, the whole picture.
Uh-huh.
And our goal really is to sift through all this for you. We want to kind of pull out the main takeaways.
Yeah, cut through the noise. What's the important stuff about Dr. Jimichi? What makes Mediglobe, tick?
Exactly. So you can get a quick grasp of the key facts without reading everything yourself.
And honestly, as we went through these sources, some pretty interesting details popped out. Things maybe you wouldn't expect just looking at a clinic website.
Okay, so let's get into it. Where should we start? Maybe with the man himself, Dr. Hasan Gemici.
Makes sense. So, the basics. Born in Antalya, 1978. He graduated from Marmara University's Faculty of Dentistry back in 2003.
All right, so that immediately tells us, what, over 19 years of clinical experience now?
Yeah, nearly 2 decades. And the sources really stress that it wasn't just, routine work. They talk about continuous professional improvement right from the get-go.
Ah, okay. They specifically mention he gained expertise, especially in surgical and prosthetic treatments.
Exactly. And how? Well, the material says he was constantly hitting up courses, seminars, workshops,
National and international ones.
right conferences too, racking up certificates over those years.
So a real commitment to keeping up to date. That seems key.
Definitely. And they also point out his connections, like being a member of the Turkish Dental Association and the ITI, that's the International Team for Implantology.
Yeah.
Pretty standard for specialists, but good to note.
And it's not just about practicing dentistry, is it? The sources identify him as the founder of Mediglobe.
Yes, and also a co-founder of another place, DH Clinic, from way back in 2010.
Oh, okay.
And he's apparently in a leadership role there, too, in management. So there's a clear history of actually building and running these practices.
That adds another layer. And practically speaking, especially for people maybe coming from abroad.
Good point. The sources highlight his English skills,
Sure.
which is, pretty crucial for clear communication if you're an international patient.
Definitely. They also mention, just for completeness, he's married, has one child, sort of rounds out the biographical sketch.
Right.
Okay, so let's pivot then. Let's talk about Mediglobe, the center he founded. Because while his background is clearly dentistry,
Yeah, the sources paint a much broader picture for Mediglobe, don't they?
they really do. They use these big phrases like redefining excellence in medical and aesthetic care.
Or the pinnacle of comprehensive medical and aesthetic care. Sounds ambitious.
It does. And what's interesting is it doesn't seem like it's just marketing speak wrapped around a dental clinic.
No, exactly. The sources actually list out Mediglobe's main service areas. And yeah, dentistry is there. Top quality dentistry for the whole family, they call it.
But alongside that,
Urology, hair transplant, and gynecology, explicitly listed.
wow, okay. So that really does change things. It's not just a dental place.
Not at all. It seems like they're positioning themselves as a multi-specialty center.
Right. Sort of a one-stop shop, maybe.
Yeah.
Especially thinking about that health tourism angle, you could potentially get different kinds of medical or aesthetic treatments.
All under one roof? Yeah, that seems to be the model they're presenting.
Okay, but let's drill down into the dental side, since that's Dr. Jimici's core expertise. The list of services there looks pretty long, too.
It is. Covers the basics, but goes into specialized stuff. Aesthetic dentistry comes up things like digital smile design.
Which, the sources suggest, is basically using tech to pre-plan a smile makeover, right?
Yeah, sounds like it. They also list zirconium and porcelain laminates veneers, essentially, those thin covers.
Gotcha. And surgically.
Jaw dental surgery is mentioned. That covers like TMJ or jaw joint issues, wisdom teeth, cysts, impacted teeth, that sort of thing.
And they mention specific tech, too, like digital dental anesthesia.
Mm-hmm. The idea being more comfortable, more precise numbing, less stressful, maybe.
And laser dentistry.
Yep, using lasers for certain procedures. Plus, they mention kids dentistry, pediatric dentistry, first visits, importance of baby teeth.
Okay. But the area that seems to get a lot of detail in the sources is implants.
Oh, definitely. The implant section is quite specific. They describe the standard placement as, an easy surgical procedure. Patient gets on with their day.
Right, standard stuff. But then they talk about these other techniques. Early implant placement and early implant loading.
Yes. Now, this is where it gets interesting for potential patients, especially regarding timelines.
How so? What's early implant placement?
Well, according to the sources, it means placing the implant right into the socket immediately after pulling a tooth.
Ah, so you don't always have to wait for the socket to heal first.
Apparently not if the situation is right. Skips a step, potentially.
Okay. And early implant loading, that sounds even faster.
It does. The sources say, again, in the right cases, the actual visible tooth part, the prosthesis, can be added within the same week.
The same week. Instead of waiting, what, 4 to 6 months usually?
That's the typical wait time for the implant to fuse with the bone, yeah. So this could be a massive time saver.
Wow. That's significant.
It is. And the material notes this allows for temporary teeth during healing, so you're not left with a gap. Plus, it helps shape the gums nicely around the new tooth.
Okay, that makes sense. They also talk about the materials for the actual teeth, right? The prostheses.
Mm-hmm. Fixed ones, they can be metal-supported ceramic, using different metals, even gold alloys.
Or zirconium supported, which are metal-free.
Right. And zirconium gets quite a bit of attention in the sources.
Why is that? What do they highlight?
Well, they frame it as a preferred material. It's durable, looks good, more natural than some metal-backed crowns, apparently. High strength.
And biocompatible. That sounds important.
Very. Means it gets along well with your gum tissue.
Mm.
Lower risk of allergies compared to some metal alloys. So presented as a really solid aesthetic option.
Okay. And what about removable options for people missing more teeth?
Yeah, they cover that too. Dentures, basically. But they mention options supported by implants or remaining teeth or just tissue. Different ways to keep them stable.
It's interesting, though. Amidst all this talk of high-tech implants and materials,
Yeah.
the sources also include a section just on toothbrushing, like basic technique.
Oh, yeah, I saw that. They give details. Brush for about 2 minutes, 8-10 strokes per tooth. Really focus on the gum line.
Right. Such a fundamental point. Kind of a contrast to the advanced surgical stuff.
It is, isn't it? Grounding it back in basic care.
Okay, let's switch gears slightly. What about the patient experience? Do the sources give us a feel for that, maybe through reviews?
They do include some customer reviews. Yeah, one mentions being really scared of dentists before.
A common fear?
Totally. But they found the team incredible, friendly, very professional, said the treatment was painless, and the result was great.
That sounds pretty positive. Any others?
Uh-huh. Another one talks about getting seen immediately for a toothache. Found the doctor very patient and explanatory. Felt comfortable. Process went very smoothly.
Patience and explanation that comes up a lot as important.
It does. And a third one praised a cleaning and whitening. Again, felt very comfortable. Mentioned the staff's interest and the doctor's professionalism. Led to more confidence.
So a real pattern there in the feedback, comfort, clear communication, professionalism, efficiency.
Yeah, those themes really stand out. And that focus on communication seems backed up structurally, too.
How so?
Well, the sources mention the team includes a translator, Ezra Ermerjan,
Ah, interesting.
and the Mediglobe website itself is multilingual, English, Russian, German, and Turkish.
Okay, that clearly signals they're set up for international patients. Ties back to the health tourism idea.
Exactly.
So if we try to sort of pull all these threads together, what picture emerges from the sources?
Well, it looks like a center built on Dr. Gemici's, quite deep and specialized dental experience.
Almost 2 decades,
God.
constantly training.
Right. But then expanding that into this broader multi-specialty model, dentistry, urology, hair transplant, gynecology.
Equipped with modern tech, digital numbing, lasers.
Mm-hmm. Detailing some pretty advanced procedures, like those potentially rapid implant techniques.
Yeah, the early loading thing.
And then layering all of that with a really strong emphasis on the patient side, comfort, clear communication, multilingual support.
Making it accessible, especially internationally.
Precisely.
Hmm.
And of course, the sources give all the practical stuff too, the address in Capez, Antalya, phone numbers, email, website, social media.
Even a health travel agency number mentioned somewhere.
Yeah, confirming that health tourism focus.
So, it seems like the material paints a picture of a pretty well-established operation, led by someone with significant experience but also branching out.
Pursuing that wider health service model, definitely, with a clear focus on patient care and reaching beyond just the local market.
What really stands out to you from digging into all this source material? I mean, we've covered Dr. Gemici's background, the surprising scope of Mediglobe beyond just teeth.
Yeah, the deep dive into things like the fast implants and the focus on zirconium.
And that consistent thread of patient comfort and making sure people understand what's going on, even across different languages.
It all weaves together.
Well, hopefully this deep dive has helped you, listening, get a clearer handle on Dr. Hasan Gemici and Mediglobe. We've tried to pull out the key bits from that stack of information.
Yeah, distilled the essence, hopefully.
And maybe just to leave you with a final thought, something that came directly from reading through these sources.
Go on.
It's that contrast we mentioned, how the material details both these really advanced, potentially time-saving things like early implant loading,
The cutting-edge stuff.
and also takes the time to lay out the step-by-step basics of how to brush your teeth properly.
Right.
It kind of makes you wonder, doesn't it, about that balance a modern health center tries to strike, between having all the latest technology and treatments.
And making sure the fundamental patient education, the absolute basics of care aren't forgotten. It's an interesting tightrope to walk. Makes you think.